Welcome to the second wave of COVID-19, and it is fierce. The number of days where there have been more than 100,000 new cases will start to be counted in weeks soon. Hospitalizations are rising. Mortality rates are rising. We still don't know for sure what the effects of too many people traveling over the Thanksgiving holiday will be, but healthcare workers on the front lines are bracing for the worst. One such healthcare worker joins me now. Rebecca Leach is an infection preventionist and a member of Infection Control Today's editorial advisory board. Becky is an infection prevention expert, but as we said, she's not sitting in any ivory tower. She's on the front lines. So Becky, what's it like out there?
Well, like you said, it's very busy. It's very hard, I think, for a lot of us who have been working in this for almost the whole year now. And we all sort of anticipated this would happen over the holidays and as states started lightening up on their restrictions. But it's really hard to see it actually happening and to be resilient and to keep moving forward. It's a long journey for sure.
Are you, one expert I talked to, one of our editorial advisory board members, in fact, Dr. Kevin Kavanaugh, he's downright impatient with the public. The public, he just doesn't think that they're taking this seriously enough, and you, the healthcare workers on the front lines, are paying the price. Are you, not to put you in a hard spot here, but are you a little bit impatient with the public? I mean, you must have family members and friends who say, oh, do I really need to wear a mask, or do I really need to social distance?
I definitely feel impatient in general with the public. I think the hard part is that we all are exhausted from this. Everybody's tired of having to change their way of life for this, and I can understand the fatigue factor in the public. I think my biggest impatience is probably more with, leadership and government, and really not, some states are doing more to be more proactive and some states are not. And that's where my biggest concern is, that we have leadership that really should be setting the standards and the expectations. And this is the time when public health authorities really need to be the ones to make those statements and be listened to. And I think if that happened, as we saw before in the summer when states really locked down or mandated masking and that kind of thing, we saw the decrease. If we did that again, I think it would have worked. I just think that there are a lot of people who just don't want to do that for various reasons, a lot of economic reasons, political reasons, that it just is very frustrating.
And what do you see as, well, for one thing, how much hope are you placing in a vaccine in maybe controlling this thing?
Well, I'm trying to be very hopeful about a vaccine, but also very realistic. We know there's not going to be enough doses until probably well into next year to really cover a lot of people that we would have to change a lot of these behavior modifications we need to do. They say in the next few weeks, potentially, that we would start seeing vaccine being disseminated here in Arizona, which is exciting news. But it's going to be limited to however many doses we get, and then of course that tier of who's going to get it first, which will be most likely healthcare workers and long-term care residents. And the whole process of how they're going to distribute it and all of that is, also a little bit up in the air. There's plans, but do they have the people to actually give the vaccines and track it and how that's going to work? So, it is hopeful, but it's not the end by any means, especially not in the next few months. I think we're going to keep seeing cases go up in the next few months until the vaccine is more distributed, or we make other changes like we did before with masking and sort of the closing down of gathering places.
Forgive me for forgetting this. You're in Arizona, you're an infection prevention expert. How many facilities do you actually oversee the infection prevention for?
Well, right now, I'm actually in a different position. So I'm in one main facility, but it's a large facility, 570 beds. And then we also have some satellite clinics and a smaller facility that we oversee. So it is part of a large healthcare system. So
how many hours a day are you in about?
Well, I mean, how many hours I'm actually here, at least 10, but, thinking about it and and working on it, you know, constantly, pretty much always thinking about it for sure.
Have you discovered tricks in regarding how to take the pressure off that you can share with fellow infection preventionists or fellow healthcare workers of any profession that are in the thick of this?
I think, you know, probably I would say that most of us who have been dealing with this for so long have had our highs and lows, where you have your days where you feel like you're energized and you can really do this, and then you have those really hard days. And I think the biggest thing is just having support, whoever it is, if it's fellow infection preventionists that you can talk to, people at home that you can talk to. It really is that emotional support of being able to talk to each other about your experiences and really process your feelings. And I think a lot of it too is we on the front lines have to be strong. We're the ones that have to do the work. And so giving yourself permission when you have those down times to really let out those emotions and let it happen will help. But I honestly think there's going to be a lot of people who have really been working more in the front lines than I am, who are going to have long-term effects from this psychologically.
When you, as far as spreading the message of infection prevention, has that gotten easier? And how do you feel about sort of deputizing other people to be part of an infection prevention team? Not officially a part of the team, but part of the effort, infection prevention effort.
I think that actually has improved quite a bit. As in the beginning, when we were first doing this, it was infection prevention who was sort of sharing the knowledge and explaining the, you know, the concepts behind the preventative isolation and transmission and all that sort of thing. And now, since we've talked about it so much, there are so many people who are knowledgeable. For example, here on our nursing units, you know, educators, clinical leaders who are very well versed in the basic infection prevention concepts and can really be that extra line of defense that we need and can offer that information, which is really nice in this kind of the second wave where we, that's a little bit of a different thing for us. We're not the only ones who have the knowledge, right? Or are being seen as the ones who need to answer all the questions. There's other people who they can turn to now. So that kind of takes a little bit of the pressure off of the infection preventionist, I think, and we can focus in on maybe other areas as just like the vaccine development and other things that we're going to be involved in going forward.
What are the things that an infection preventionist and only an infection preventionist can deal with at a facility?
Well, for example, what we saw with the first wave, the big wave here over the summer in Arizona, was a lot of our patients who had COVID also developed other hospital-acquired infections such as Claudia and CLABSI. We saw a huge increase in that. And I think that's been shown pretty consistently across the country in other journals and articles and information. And so that's some of the work that we're trying to focus on here is how we know we have these patients who are incredibly challenging treatment-wise. How are we going to prevent this time around? How are we going to not have Claudia and CLABSI increases for our patients with COVID? How do we maintain that standard work of the preventative bundles that we know we need to do with such a challenging population? And are there things we need to do on top of what we're already doing for these patients? So that's some of the work that we can focus on as well.
Well, another expert told me that within the next 10 years, she expects about 40% of the infection preventionists currently working will retire. Do you see this, ironically, as maybe holding up infection prevention, being an infection preventionist as possible a career path for younger healthcare providers?
I think so, but I'm also thinking maybe this pandemic will inspire more young providers to become infection preventionists because it's such a more exposure to different areas where people didn't always know what we did or what our jobs involved. And maybe this will inspire people to become involved in infection prevention and public health in different ways. So I'm hopeful that that might come out of this as a little bit more exposure to what our jobs are, as well as a little bit of a evolution in what we do. And we're seeing more in this emergency response area as pandemic planning and other things that we in infection prevention always knew we were an important part of, but now I think everybody kind of sees how important we are in it.
Are you speaking now from your facility, or are you speaking now from home?
I'm at my hospital.
So just out of curiosity, when this interview's over, you're in an empty room at the moment, right? With the airflow, right? What are you gonna do all the donning and doffing and putting on the goggles and all that stuff when you enter the hallway?
Yeah, so right now I'm in here by myself, but we have universal masking and eye protection required for all staff who come in the hospital. And then of course, if I were to go in a patient's room that was in isolation, then I would add the gown and the gloves as well. Or if it was a N95 necessary, then I would put that on. So yes, yep. I don't see myself without goggles and masks very often.
Do you feel a little bit pressured? I mean, like you're the infection preventionist, you have to set the example, and so almost you got to be perfect doing the prevention protocols, right? Feel a little bit of pressure?
Well, I always have felt that pressure, even before all of this. You know, people watch us. If we're going in and doing rounds on patients, we better be doing our hand hygiene before and after, and we better be making sure we're following those guidelines. And so I've always felt that, you know, people are always kind of watching you set the example. So especially with this, you know, there's been times where I've walked out and forgotten my mask and I'm like, I gotta run back in and grab it. You know, you just forget sometimes, but that's normal.
Hospitals can be hierarchical institutions, so you have to sometimes flag a doctor or a surgeon or hospital administrator and say, hey, you're not doing this right.
Yeah, we try to really empower everybody to be able to do that, as well as have people understand if somebody says something, you know, don't take it personally. We're all just trying to watch out for each other. So it is very hard. And even before COVID, you know, that's kind of that culture of safety that we've always talked about with infection prevention for a long time. It just having, you know, anybody from any position in the hospital be able to speak out if they see something that may be a safety issue. And so with COVID, for sure, it's important, but it's been important for a long time. And some facilities are really great at it and have that culture of safety, and others are still on the journey. And so this definitely is something where, you know, people, I think because of that sense of personal safety, maybe people feel a little bit more empowered to speak out. But I think there still is that hierarchical concern for certain groups. And that's something we, as an organization, people would need to work on for sure.
Anything I wanted to ask you about what it's like on the front lines that you think might be pertinent and important for your fellow infection preventionists and any other healthcare professional to know that you've learned?
I think the biggest thing that we need to keep in mind is we're all on the same team. And so there will be times when people are just tired, and we need to be empathetic to that and understand that if questions or people challenge the recommendations or some of the processes that we put in place, to approach it not from a position of defensiveness, but to really understand where they're coming from, because their experience may be different than mine. And I need to understand what they're going through and how it'll impact them, and as well as what they have learned, because everybody has learned different things in doing different parts of this pandemic response.
Rebecca Leash, as always, thank you so much for joining us here in Infection Control today.
Good to talk to you.
And good luck in your endeavors, and stay healthy and safe.
You as well.
And now back to you, Gina.